Now, there's another part of taking history for hypertension patients, which is very important. And this part is you're trying to ask them for the drugs they have been taking in the time past. So you are taking past medical history and also past drug history. So past medical history, you are trying to look at what disease do they have now, or what disease have they had before that was like serious. Then drug history, we are trying to find out at least what type of drug have they taken within that short time being, you know. So you are trying to identify the risk. Do you understand? What has actually caused this increase in blood pressure? So the things that you should cover in past medical history that you shouldn't miss include the following. So how long have they been having that hypertension? Okay. And when was the hypertension first diagnosed? Have their blood pressure ever returned to normal, then shoots back again? Then you also ask if they have been having these high blood pressures before, what treatment did they actually sought after? The comorbidities, you are looking at the cardiovascular, so you are trying to see if they have coronary artery disease or heart failures or arrhythmias. You are looking at the kidneys if they have chronic kidney disease or recurrent urinary tract infections, if they have had their kidneys removed or polycystic kidney disease. Then for the endocrine, you are trying to see if they have any hormone related disease condition. So when they sleep, do they sleep very well or they find it difficult to breathe? That's obstructive sleep apnea. They also ask if they are obese, lipid regulation is not okay, or there's any metabolic syndrome. Also, family history, you ask if they have hypertension, premature cardiovascular disease too. Then lifestyle history, you ask if they smoke, if they take alcohol, you know, the physical activity level, you're asking for also their dietary habits and if they are stressed, also their sleep quality. So for the drug history, you ask what current antihypertensive medications they are taking because some of these patients they might have gone to other places to sought for help before they came to you. You ask what dose they are taking. Do you understand? And you ask if they are taking all those NSAIDs, all those ibuprofen, naproxen, oral contraceptives, steroids like prednisone, dexamethasone, antidepressants, decongestants, you're asking all of that. They're also asking if they are taking any over the counter drug or any herbal remedies. You also try to know which herbal remedies they are taking and which over the counter drug they are taking. Then finally, you get to know if your patient takes a lot of alcohol or if they take cocaine or amphetamines or if they do any drug abuse in general.